Hi everyone, today we are going to talk about gestational diabetes. Gestational diabetes is diabetes diagnosed for the first time during pregnancy. Gestation. Like other types of diabetes, gestational diabetes affects how your cells use sugar. Gestational diabetes causes high blood sugar that can affect your pregnancy and your baby's health. How do we diagnose gestational diabetes? The doctor will give you a glucose tolerance test or OGTT. You'll drink 50 grams of glucose in a sweet drink, which will raise your blood sugar. An hour later, you'll take a blood glucose test to see how your body handled all that sugar. If the results show that your blood sugar is higher than a certain level, you'll need a 3-hour oral glucose tolerance test, meaning you'll get a blood glucose test 3 hours after you drink 100 grams glucose of drink. Your doctor can also test you by giving you fast for 12 hours, then giving you a 75-gram glucose drink and a 2-hour blood glucose test. What are the causes of GDM or gestational diabetes? When you eat, your pancreas releases insulin, a hormone that helps move a sugar called glucose from your blood to your cells, which use it for energy. During pregnancy, your placenta makes hormones that cause glucose to build up in your blood. Usually, your pancreas can send out enough insulin to handle it. But if your body can't make enough insulin or stopped using insulin as it should, your blood levels rise and you get gestational diabetes. What are the risk factors of gestational diabetes? 1. Overweight before you get pregnant. Are African, American, Asian, Hispanic, Alaska Native, Pacific Islander, or Native American. Have blood glucose levels that are higher than they should be, not high enough to be diabetes. This is called prediabetes, and have family members with diabetes. Also, have had gestational diabetes before, have polycystic ovary syndrome or another health condition linked to problems with insulin, have high blood pressure, high cholesterol, heart disease, or other medical complications, have given birth to a large baby, have had a miscarriage, have given birth to a baby who was stillborn, or had certain birth defects, are older than 25. The American Diabetes Association recommends these targets for pregnant women who test their blood sugar: before a meal, 95 milligrams per dl; after an hour after a meal, 140 milligrams per dl; and 2 hours after a meal, 120 milligrams per dl. What are the symptoms? Increased thirst, needing to pee more often than usual, a dry mouth, and tiredness. Effects: most women with gestational diabetes have otherwise normal pregnancies with healthy babies. However, gestational diabetes can cause problems such as: 1. Your baby growing larger than usual. This may lead to difficulties during the delivery and increases the likelihood of needing induced labor or a cesarean section. Polyhydramnios: too much amniotic fluid, the fluid that surrounds the baby in the womb, which can cause premature labor or problems at delivery. Preeclampsia: a condition that causes high blood pressure during delivery and can lead to pregnancy complications. Premature birth: giving birth before 37th week of pregnancy. Your baby may develop low blood sugar or yellowing of the skin and eyes, jaundice, after he or she is born, which may require treatment in hospital. The loss of your baby at stillbirth, though this is rare. Monitoring: if you have gestational diabetes, you need treatment as soon as possible to keep yourself and your baby healthy during your pregnancy and delivery. Your doctor will ask you to check your blood sugar levels, check your urine for ketones, chemicals that mean your diabetes isn't under control, eat a healthy diet, and make exercise a habit. Take these simple steps to stay healthy. Eat a healthy, low sugar diet. Talk to your doctor to be sure you're getting the nutrition you need. Follow a meal plan made for someone with diabetes. Trade sugary snacks like cookies, candies, and ice cream for natural sugars like fruits, carrots, and raisins. Add vegetables and whole grains and watch your portion sizes. Have small meals along with 2 or 3 snacks about the same time every day. Get 40% of your daily calories from carbs and 20% from protein. 50% of the carbs should be complex, high fiber carbs with fat being between 25 and 30%. Aim for 20 to 35 grams of fiber a day. Foods such as whole grain bread, cereals and pasta, oatmeal and vegetables and fruits will get you there. Limit your total fat to less than 40% of your daily calories. Saturated fat should be less than 10% of all the fat you eat. Eat a variety of foods to make sure you get enough vitamins and minerals. I hope today you have learned about gestational diabetes. Thank you for watching. Kindly subscribe.